Preparing for the surge, California hospitals bracing for thousands of coronavirus patients in the coming weeks, while the state is still looking for more beds. Good afternoon. Thanks for being with us. I'm Dina Kupfer. We are standing by waiting for the governor to begin his afternoon briefing, and it sounds like he is now getting underway. Let's listen in.
Honestly, it took me a decade plus to figure out what she was ultimately saying, but she was focused on, more than anything else, our capacity to be resilient and to meet challenges head on. Our capacity as human beings to refocus our energies, our sense of purpose, and a sense of optimism and faith that we'll get through times challenging, times like today, difficult moments that all of us are working through to reconcile the world we're living in, to reconcile the need to pay our rent, our mortgage, to understand whether or not we could educate our kids at home with all of the other burdens and challenges that we face within the household, and where we're going as a state and as a nation. The old adage, we're nothing but a mirror of our consistent thoughts. Whatever we tend to focus on, we find more of. And if you're like me, you're focused on the nightly news, 24/7 cycle, 7 days a week. There's a lot of anxiety running through those broadcasts, a lot of fear that is induced focusing on what this nation and the world is doing to meet this pandemic head on. That stress is manifest. That stress is real. And all of us work through that stress differently. No one can moralize how some people deal with it versus others. Some people are coping quite well. Others are struggling, understandably. Struggling because they lost their job and they don't have a paycheck. Struggling because their kids aren't at school. Struggling in ways where they're having a hard time sleeping, where they're a little bit shorter, a little more irritable, and they're prone to doing things that aren't healthy. They may be drinking more than they should. I don't just mean adult beverages, high sugar drinks. They may not be taking time to breathe. They may not even be taking time to reflect on their own health and the need to exercise, to hydrate, and to focus on reaching out and embracing someone else, or calling for help, calling a friend and saying, you know what, can I just talk? We recognize, I recognize, we all, I think, recognize the nature of this moment. And I just want folks to know that staying at home doesn't mean you're alone. That as a state, we are here to do what we can to support you and to be there at a time of need. I've tasked the Surgeon General of the state of California, Dr. Nadine Harris-Burke, to put together a strategy and a protocol to help support you and to support caregivers that need the peer-to-peer support, a little psychological first aid themselves to get through the day and to continue to thrive, not just survive in terms of the workload as they're taking care of people all throughout the state of California. I've asked her to consider not only the physical health needs of Californians in the context of addressing the issues of this virus, but the brain health needs, the mental health. After all, the brain is part of the body, and there's nothing to be ashamed by recognizing your own limitations in terms of the stress and the angst that you may feel. In fact, there's probably no one stronger than when he or she recognizes those stress points. And so we are putting out guidelines. We're putting out guidance not only to our health plans in the state of California, both on the private side and on the public side, our medical system, but we're also putting a playbook together for you, a checklist as adults, as caregivers, but also a checklist for our children, because everything I just said is translated very differently into our children. Our children aren't able to communicate words like this, boy, I'm completely stressed out. Not a young child, maybe a teenager, but not a young child. And they manifest stress very differently. They have a tummy ache. They may not be sleeping as well. They may be particularly irritable, sort of jumping back and forth. Well, I explained my daughter a few weeks ago as she threw her bed over because she was so upset when I told her it's likely she wasn't going to go back to school and see her friends this school year. Everybody manifests this differently, and our children are most vulnerable because they're not able to communicate as effectively as many of the adults and caregivers. So we have a playbook for them as well, a checklist for our children as well. And we have resources. We have on our covid19.ca.gov website, covid19.ca.gov website, we have 16 hotlines that we have made available, including text chat lines where people can address their particular needs as it relates to domestic violence, intimate partner battering. We're seeing increasing in times of stress and the need to get help. You can call that DV hotline. Elder abuse. We obviously have to take care of our seniors. We have a hotline for that. Child abuse. We have a hotline for that. Teens feeling deep emotional stress that are feeling in crisis. We have a teen crisis hotline. All of these things available in many, many languages, up to 170 languages in some instances. LGBTQ and their unique challenges. Across the spectrum, supports, substance abuse, alcohol abuse, all of those hotlines, all of those resource sites are available on covid19.ca.gov to help support you during these times of needs. There's also concern, and I'll ask the doctor to come up in a second, around secondary health effects. We talk about your physical health as it relates to making sure we stay at home, we practice physical distancing, we continue to do what we must in terms of our personal hygiene, washing our hands, and the like. But it's also true that stress hormones create the kind of anxiety that induces other secondary effects. It impacts your blood pressure. It impacts your heart and can increase the likelihood of a stroke. It can impact your diabetes. It can certainly impact your sense of well-being and depression and the like. And so the secondary health impacts are a big part of what we're also looking to respond to. And that's, again, the purpose of the guidance we're putting out today and the incredible work that our Surgeon General has been doing to integrate the behavioral mental health side of the world and the substance abuse side of the world. She's been working for many, many weeks to put together the guidance that we're putting out today and to meet these challenges head on and to be there and extend a hand for you at this time of great stress and need. And so I shouldn't belabor this. Let me just ask her to come on up. And your Surgeon General, we're proud as a state of California to have our own Surgeon General, but her expertise has been and continues to be trauma-informed care, a world expert in this space, and she's bringing that expertise to help address this moment so all of us can work through that fear and anxiety as we all are capable of doing with resiliency and the capacity to adapt to the moment as long as we have the support to get through this moment. With that, Dr. Burke-Harris.